Hello, and thank you for joining us tonight for our free webinar, the Neuroscience Acupuncture Conference Sneak Peek, Neuropuncture Scalp Treatments, featuring Dr. Michael Corradino. My name is Jeff Bloom, Education Marketing Manager here at LASA OMS. For over 40 years, LASA OMS has been striving to promote the growth of the acupuncture industry by providing quality products, great prices, and the best customer service, as well as supporting the many schools and continuing education efforts available. With our free webinar series, we intend to provide free educational opportunities taught by some of our industry's most renowned practitioners and educators. I would like to take a moment to acclimate you to the webinar room. To the right of the video screen, you'll see 3 tabs: chat, questions, and polls. To chat with other attendees or to communicate any technical difficulties, please use the chat tab. For questions of the guest speaker, please make sure to use the questions tab to assure that we see them at the end of the lecture. Please note that immediately following each webinar, you will receive an email with a link to view the video on demand and a copy of the slides. And you may always visit our blog and use the free webinar tag to find all of our previously recorded events. From neuroscience to sports acupuncture to Chinese herbs, you'll find something interesting for every practitioner on the LASA OMS blog. Now for our featured speaker. Dr. Michael Corradino graduated from the Pacific College of Oriental Medicine cum laude in 1995. His undergraduate studies combine molecular biology and philosophy. Dr. Corradino has been in the field of integrative medicine since his graduation for the past 25+ years. His mission in life is to reach and expose quality traditional Chinese medicine to as many people as possible and to present an effective quality option for healthcare and aiding in the integration of Eastern, Western, and natural medicines. He is the founder and president of Neuropuncture, the only complete neuroscience acupuncture system in the world. He's also the founder of the Neuroscience Acupuncture Conference, which is happening on February 19th to the 21st. Please join me in welcoming Dr. Michael Corradino.
Thank you, Jeff, for such an awesome introduction. I really appreciate that. And thank you for this opportunity. I want to thank LASA and Jeffrey Bloom for the support and for reaching out and supporting the conference. So hello, everyone, and welcome to our little sneak peek to the Neuroscience Acupuncture Conference. This is the Neuropuncture Scalp System sneak peek. So a little sneak peek into the Neuropuncture Scalp System. And I think you're really going to enjoy this, and we're going to have a lot of fun. Okay, so I first want to begin by just really reaching out and giving my heart and my sincerity to anyone and everyone who's been affected by the COVID pandemic. Some of us have family members that are sick. Some of us might have gotten and contracted it ourselves. A lot of our businesses have all been impacted. Everyone, I think, has been impacted. I want everyone to know that we're not going to forget that. And we're all here to definitely support you. So without further ado, what is the Neuroscience Acupuncture Conference? So this is a very unique, special conference, unlike anyone else or anything else in the world. And I want to just go over the mission, talk a little bit about it before we get into the Neuropuncture Scalp System. So our mission at the Neuroscience Acupuncture Conference is to dedicate the integration of acupuncture with neuroscience in order to advance the profession and improve clinical outcomes. Our goal is to bring 21st century medical sciences and their clinical applications, very important there, to the acupuncture profession. Raise the bar of scientific evidence-based acupuncture education, as well as present groundbreaking neuroscience acupuncture scientific research. It is our belief that this will assist in galvanizing acupuncture into the heart of mainstream medicine where it belongs. We have speakers that are internationally renowned, internationally teachers, researchers, and from all different aspects of medicine. Medical doctors, doctors of osteopaths, naturopaths, licensed acupuncturists, and we want to bring that science to our acupuncture profession so that we can really put acupuncture where it belongs, and that is inside the heart of mainstream medicine globally, worldwide. It is an international live stream conference, and it is next week starting on Friday. We'll get back to that. Okay, now we're going to talk about neuropuncture. So neuropuncture, all the work is copyrighted protection, it's trademark protected, and it is a patent pending system. So some of you might not be familiar with neuropuncture. This is the neuropuncture trinity. And we use the word trinity because it's not to offend or take away from a holy trinity or anything like that. It's because it has 3 aspects to this chart. And if you look over to the right there, we have the neuropuncture neurophysiological mechanisms. With those 5 neurophysiological mechanisms, we can explain any clinical acupuncture phenomenon. Okay, we have that local effect, what happens at the tip of a needle when it's inserted, the spinal segmental effect, looking at spinal reflexes and the chemistry that happens at each spinal segment, the endogenous opioid circuit. Acupuncture has been known for millenniums on how great it is at down-regulating and treating pain. Well, this is exactly how that system works, and we can tap into that innate biological evolutionary system and modify it. And then we have the central nervous system mechanism, everything outside, which is the brain. We're going to discuss that a lot tonight. And then there's a neuromuscular and myofascial trigger points mechanism. And then there's treatment principles. The treatment principles are how do we apply those mechanisms to clinical cases? If you have a medical diagnosis or if you're doing some form of assessment or exam to determine the underlying neuropathology, then we'll understand the mechanisms. We have treatment principles to harness those mechanisms and then focus the treatment at that neuropathology to heal the patient. And then we use electrical acupuncture. It has been shown in clinical research to be superior than manual acupuncture, definitely in pain management and in other areas of medicine as well, specifically when we're doing neuroplastic changes in the brain and in the central nervous system. We have 5 electrical techniques that we'll be discussing some of them tonight. Now with neuropuncture, there's a clinical process. Why is there a clinical process? Because we understand that the language we use and that we study in traditional Chinese medicine dates back 2,500 years. And they use that language to do what? To understand, to explain, and to interpret the physiology as well as the phenomenon that they were observing in clinical practice in their medical profession, which was acupuncture and Chinese medicine. Now we have 21st century medical sciences. So if there's a Western medical diagnosis, guess what? We're going to be able to get to the root of that patient's pathology or condition, right? And we pride ourselves in that in TCM and acupuncture at treating the root, right? Gun and bound, right? Treating the root of the condition. Now, if we don't have a medical diagnosis, well, then we still like to take tongue and pulse in neuropuncture. I still love those TCM diagnostics. And then there's a lot of other exams and images that we can either order ourselves or we can read medical reports or lab tests that we can order as well to, again, better understand the neuropathology of our patient's condition. Then there's a clinical assessment, which we'll get to in a quick second. And now in neuropuncture, we have an auricular system, we have a scalp system we're going to talk about today, and a whole body system. And what we do is we can combine all 3 of those systems to really best do 3 things to our patient's nervous system, which is neuro-modulate, neuro-rehabilitate, and neuro-regulate our patient system back into health. We love extra modalities because Chinese medicine, the medical holistic approach, dates back when the Huangdi Jing was one of the first classics in medicine that stated about preventative medicine, right? That it wasn't a deity or a ritual that caused an illness. No, it was either the internal evils, our mental health, or external evils, something from the outside penetrating in. So we love that holistic approach on treating all that areas of the mind and body. So acupuncture injection therapy, if you could do that in your scope, Tuida, traditional bone setting, cupping, gua sha, jiao, homemade liniments, infrared, TDPs, MOX, and any other treatments you may use, herbal medicine, metabolic detoxification programs, nutraceuticals, anything you use also to just, again, benefit your patient. But when it comes to acupuncture, acupuncture is neuroscience. And it's really important we understand that, know how it works, and then we can harness and apply that to clinical cases. What this gives us is fundamental neuroscience-based body, scalp, and auricular prescriptions for maximizing that neuromodulation. Now, with the auricular system, we do have certain techniques and tools we use for assessment, but we're not going to get into that tonight. And then this is the assessment. Once we find that neuropathology, and that could be something simple as getting a diagnosis that is maybe foreign to you. It's bizarre. You never heard it before. I've done that myself. A patient tells me, "Doc, this is what I've been diagnosed with." I'm like, "Excellent. How do you spell that?" And then I'll go to my office and I'll Google it. And then look at the neuropathology of it. Oh, that's what's causing this patient's symptom, right? That's what's causing this patient's condition. And then by understanding the detailedness of the Trinity, then we can, if we don't already have a prescription in neuropuncture, we have about 70 to 90 treatment prescriptions that are patent pending right now. we give you the tools to create your own neuropuncture prescription, which is a functional point prescription or protocol, the neuropuncture dosage, electrical signature to best target those structures, and then a treatment plan all based on neuroscience, gene expression, and neuroplasticity. So what is the Neuropuncture Scalp system? So the Neuropuncture Scalp system incorporates the science of cerebral neuroanatomy and neurophysiology, right? So we want to know the location of an age area or region of the brain or section of the brain, and then we want to know its functions. We're going to talk about that tonight, location and function, right? And then we got to understand electrical sciences. I know that's not taught a lot, much at all in our training, but it is a wonderful way to neuromodulate our patient system. It's very powerful. And then we apply all that theory to scalp EA. Another thing that some people frown upon is that safe. It's very safe. And I'm going to show you how to do that tonight. And then we use Neuropuncture Scalp. We call them functional acupuncture units because point actually was a mistranslation. They're not points, okay? The NIH ran some great trials and confirmed that an acupuncture point is really a neurovascular node, and it's a region, okay? Not one acupuncturist will find one point in the same region, and that it will have the same neural signature. So they're really kind of units we look at. The Neuropuncture Scalp is a discipline that brings together neurophysiology, molecular biology, neurotechnology, right? Very important. And then published electrical acupuncture research to develop neuropuncture prescriptions to, again, neuro-regulate, neuro-modulate, and neuro-rehabilitate the nervous tissue of underlying brain structures and stabilize brain chemistry. When you combine the neuropuncture body and auricular systems with the scalp, we can further target cerebral regions of the brain and enhance the area for maximum activation and elicit neural signatures. Because when you study the brain, you're going to realize, and this is very well proven in neuroscience, there's not really necessarily one aspect that does one thing. They do, but it's usually communication within the brain itself. You know, they communicate with different regions and different areas that elicits this expression of consciousness is one actual phenomenon, right? Consciousness is not one area in the brain. It's a signature that gives us this perception of reality that we see. So now, going back to the Trinity, let's apply this and look at this and how it applies strictly and solely to the scalp system. So again, right, we have 5 neurophysiological mechanisms. So when we look at this, the local effect. Normally, when we're talking about the local effect in neuropuncture, we're talking about when we insert an acupuncture needle, right? These beautiful, thin, stainless steel, disposable, filiform, microscopically round needles into a patient, there's this reflex and there's this chemical soup that gets produced. But we're not going to use that on the scalp. So when we look at the local effect in scalp neuropuncture, we're looking at the deep cranial electrical acupuncture stimulation, harnessing that technique to penetrate to the cortical structures. And then we're also going to be talking about the electrical acupuncture magnetic field that gets generated between needles to, again, generate a field to target those cortical structures. So that's the local aspect that we're going to apply to scalp. Is there a spinal segmental effect added or applied? Of course not, right? Because the spinal segment that's below the brain, right? Is there an endogenous opioid circuit? There is, but we're not going to use that. We use the body system to engage the endogenous opioid circuit. The central nervous system, absolutely, right? That's when we want to learn to communicate with the master CPU. And is there a neuromuscular aspect? Of course not. And look at the treatment principles. Yes, that harness that local effect. So there's techniques we learn to harness that local effect. And then there's definitely prescriptions that we can target specific regions of the brain to release specific neuropeptides. Now, when we look at the electrical techniques down below, again, is there reducing the inflammation on the cortical structures that we're going to be doing? Absolutely. But when we look at neuropuncture, that's actually a very specific dosage, electrical signature, and a protocol that we use in neuropuncture that targets specific cellular functions to reduce neuroinflammation. That's not what we're going to be doing here. But 2, yes, we are going to use specific electrical techniques to target specific brain regions in the scalp system or target specific neuropeptides. We're not going to be using any spinal reflexes. It's not a specific nerve that we're targeting, but we're definitely going to be working on that deep cranial electrical acupuncture technique and the electrical acupuncture magnetic stimulation. So we look at the Trinity and you take a step back. Now you'll see, okay, so when we look at the scalp system, it cleans the trinity up. So all you got to think about is that local effect, the central nervous system mechanism. We go into a lot about that in NeuroLab. And then in neuropuncture, we have the treatment principles to harness that local effect and then target the regions of the brain. Then we have electrical techniques to do all that as well. Okay. Now the neuropuncture 21st century medical mindset. Again, it's so important we use 21st century medical language, okay? Why do we want to use that? It's not Western language. Let's not get confused with that, okay? This is language that they use when I travel to Israel or Europe or New Zealand or Australia or even China, right? They understand neurophysiology, neurotransmissions, and that type of language, right? So that's the language we're going to use that's used globally so that we can communicate with anyone and everyone, physicians, patients, practitioners. So when we look at that medical mindset of neuropuncture for scalp system, what we're going to do with the mindset we want to think about with our patients is to do what? We want to target the central nervous system and specific pathological regions of the brain to neuro-regulate and neuro-rehabilitate the cerebral areas via neuroplasticity and stabilize brain neurochemistry via neuromodulation. We want to target specific receptors to release specific neurochemicals, dopamine. We may be targeting serotonin, GABA, benzos, melatonin, BDNF or GDNF, brain-derivative neurotropic factors or glia-derivative neurotropic factors, or even SOD, superoxide dismutase, a very strong enzyme that helps clean the brain. Those are the things we want to keep our mindset on. We really want to kind of step away from maybe nourishing liver blood, tonifying spleen chi. I think that can confuse definitely our patients, definitely healthcare practitioners in any other field of medicine. But for even ourselves, because we can quantify this, we can see if our treatments are working, right? We can get follow-up exams that we did prior to our treatments and then do post-treatments to see if our treatment's working because we know what we're looking for. You know, I think that's very important. So with the Neuropuncture Scalp system, these are some of the targeted cerebral structures. I'll be addressing a lot of this at the conference, okay? Tonight, we're going to go over just a couple areas, but let's review this. So with our system, the Neuropuncture Scalp system, we can target forebrain, midbrain, or hindbrain structures, the different lobes, the frontal, parietal, temporal, or occipital, the primary motor cortex, the primary somatosensory cortex, corpus callosum, the cortical nucleus tractus solitarius, that's where a lot of benzos and GABA receptors are located. The reticular activating system for sleep, for insomniac. Hippocampus, pituitary, hypothalamus, thalamus, the prefrontal cortex and the dorsolateral prefrontal cortex, the anterior cingulate cortex, the amygdala, and the cingulate gyrus. Those are all regions and areas that are also associated with the limbic system, but that's not all of them. And there's other regions that are also included in the limbic system. The basal ganglia, very important structures for us to identify with. Know the location, know the function, and then most importantly, how do we access them with electrical acupuncture and neuropuncture techniques? The language centers, Broca's and Wernicke's, very important. Cerebellum, visual cortex, and auditory cortex. Now you could probably, just by looking at this list, you can probably think of all the conditions that you can treat if you knew how to access these conditions or these structures. And it would be really nice to be able to communicate that not only to your patient, but definitely to any referring physicians. And that is quintessential. Okay, so we're going to talk about, let's first start about the cerebrum. So the cerebrum is that outer layer, that cortex on the outside that encases the midbrain and the hindbrain, right? And it's that thick layer, okay? It contains 4 lobes and it's 2 hemispheres, right? You have the right hemisphere and the left hemisphere divided by a large gyrus, right? Big central cut in the brain, right? And then the corpus callosum links the two together, right? And that's where actually epilepsy occurs. That electrical component or electrical energy passes through the corpus callosum and causes the patient to seize. So each hemisphere has 4 lobes. We have the frontal lobe, we have the parietal lobe, the temporal lobe, and the occipital lobe. I'm sure you all heard of that, right? Let's just review them and talk about a little bit about their function. It's important to know that the frontal lobe has a lot to do with cognitive function, right? This is what makes us humans, right? Gives us this prefrontal cortex to calculate, to look into the future, to prepare for things, and have a larger area for concentration. And there's actually an emotion that also is governed by the frontal lobe. Does anyone know? There's also some movement and activity. I can't read that because I'm looking at the PowerPoint, but I want you guys just to answer in yourselves as you're watching this. Frontal lobe also has to do with empathy. All right, that's why when sometimes people get a lot of head trauma to the front, they have impulse behaviors. They lose that empathy and they can do some bad things. The parietal lobe, processing information about temperature, taste, touch, and smell. So we're going to talk about that a little bit. So if you catch up to some of those things. The temporal lobe, processing memories, integrating them with sensations of taste, sound, sight, and touch. So there are certain sensory organs that are in those areas of the lobe that bring all that stimulation together to give us memories. The occipital lobe, primarily for vision, right? I think all you kind of know that, right? Frontal lobe also has to do with movement and voluntary activity. So as everyone kind of see, right, there's some really nice things in there we're going to talk about right now. Okay, so I think everyone can see my pointer, or is that just for me? Anyway, okay. Here.
Michael, sorry, they actually can't see anything that you're putting on the screen. I apologize.
That's okay. Just wanted to make sure. Okay, so here we have the frontal lobe, okay? The parietal lobe is just posterior to that. Occipital lobe is in the back, and the temporal lobe is actually underneath those, right? Now we have this big central gyrus right here that separates the frontal lobe and the parietal lobe, and then there's occipital and temporal lobe. So we're going to talk about the primary motor cortex and primary somatosensory cortex. So real quick, another little test. Do all of you know where they are located? Does everyone know where the primary motor cortex is located? Is it on the frontal lobe? Is it on the parietal lobe? Is it on the temporal lobe? And again, just answer it yourselves. Think about it, okay? All right, I know, Mike, I think it's over here. I got that. Okay. How about the primary somatosensory cortex? Where is that located on here? Are they on the same lobe? Are they on separate lobes? Or are they divided between multiple lobes? Well, actually, the primary motor cortex, the motor region that we want to affect when someone's paralyzed or someone has a stroke and they can't move, or if they have MS and the scarring has scarred that aspect of the brain where they can't move, is actually on the most posterior end of the frontal lobe. And then just behind the motor cortex is the sensory cortex, right? The somatosensory cortex. And that is actually on the parietal lobe, okay? And why is that exciting? Because the frontal lobe has to do with activity, as we just went over, right? And the parietal lobe has to do with sensations, okay? Now, we're going to go over how it's broken down along that. But let me ask you another thing now. Do all of you know how does our sensations travel to the brain? How do we feel sensations, right? They come from the peripheral and they ascend, right? Those are all ascended tracks. Does everyone know what they're called? And then on the flip side of that, the motor transmission is what? That actually is all descending tracks, right? Because that comes from the brain down the spine, right? So sensory comes in, we know, like Da Chi sensations, right? That all travels along the primary afferent nociceptive system. And there's all specific neurofibers that transmit specific Da Chi sensations. And that sensation travels up the spine into the brain. That's why it's called the spinal thalamic tract, right? Spine thalamus, right? Then it goes into other areas of the brain like the primary somatosensory cortex. And then the primary motor cortex, right, starts where? In the brain. And it goes to what? The cortical spinal tract, right? Because it originates on the cortical structures of the brain, and then it travels down into the spine, right? So here we have the cortical spinal tract and the primary motor cortex, right? That is on the frontal lobe, right? So the primary motor cortex is actually on the frontal lobe, and the primary somatosensory cortex is on the parietal lobe, right? So they're actually on two different lobes, separated by the central gyrus, and the cortical spinal tract is what initiates and carries the transmission for movement, controls movement of the limbs and trunks and legs, lower limbs. And the primary somatosensory cortex has the spinal thalamic tract where it terminates in the brain, okay? And that brings all that sensory sensation up into the brain. Now, look at this. This is really, does anyone see anything that should be really impactful? That makes a big difference when you want to reach or activate certain regions of this homunculus. First, we can see how big the face and lips are, right? And the hands. Right? For evolution, that was because you got to protect the face. And the hands were for touching things, right? So I always tell my patients, I explain this to them in my clinics because I think it's important to educate my patients. And if I were to take an acupuncture needle and let's say I were to put this just on your low back, and if I move it over just a little bit, you're not going to know where it is. But if I put it on your face, I mean, if there's a bug on your face, you feel every leg of that bug as it's crawling on your face. Why? Because that part of the face has a larger region of the brain that maps that somatosensory input, okay? But look at the leg, guys. The knee starts at DO20, okay? Not the foot. And that's a kind of a misconception a lot of people, I think, get confused with, okay? And the whole body kind of goes about, 3 inches off from DO20. Everything below that starts to be the face, lips, and mouth and tongue. And guess what? I don't needle that in scalp. Why? Because if I'm going to work on the face, I work on the nerves of the face. And we have neuropuncture prescriptions and points to directly target and treat facial conditions that then will transmit sensations back to these regions. But to needle into the temporal muscles and always temporalis muscles, it's going to be very sensitive. So I stick to just those 3 inches. I'm going to show you techniques to get down there. But that's really important to know. The foot is not here. It's actually the knee. And then it runs down. So here we are again, right? So we have the frontal lobe, that central gyrus. The motor cortex is just anterior to the parietal lobe, and just posterior to the motor cortex is the sensory cortex on the parietal lobe, okay? Another interesting fact, fun fact, is what's on the bottom of the motor cortex is what? The mouth, tongue, and lips. Guess what is near that region? Broca center. On which side of the brain? Which side of the brain does speech come from? Could be right, could be left. Everyone that said left is correct. And right where Broca center is where near where that is, because Broca has to do with pronunciation of language, because it activates that motor cortex of the mouth, lips to pronounce words. That's why it's neat to know this stuff. And here we have it right here, okay? And again, I like to stick just in that aspect of the scalp system, okay? I got a nice head you can look it on really good. And now this is a cadaver. We have neuropuncture cadaver training where we go to, right now we have a great relationship with the Mark Institute in Miami, and we've had some great workshops there. We have a couple that are coming up. And I'm doing some special research there right now that I can't wait to bring to our profession. It's going to be groundbreaking and just bringing us up another level. But look how deep that gyrus is. Look at this. That is a huge section of the brain, right? And that primary motor and sensory cortex wraps down in there, okay? And I always show this. It's always good to feel it. I mean, you could feel your hands go right into the brain. You have to keep that medical mindset so that you don't kind of get a little freaky out by that. But I think it's a beautiful thing in the human anatomy, and there's no replacement to medical training than human cadaver training. And seeing structures like this, touching it and examining it really helps you become, I think, a better practitioner. And it's great conversations with referring doctors at cocktail parties or networking parties, right? Okay, so when we go back to the training, when it comes to the scalp system, right, we're going to harness that deep cranial electrical acupuncture stimulation effect, electrical magnetic field, and we want to definitely target the central nervous system and target regions of the brain and receptors, okay? So here's the trinity. What I want to do just tonight is review the electrical aspects, okay, of it, okay? The electrical techniques. So in the trinity, it's 2 and 5. So just 2 and 5 is going to apply to our scalp system. So what techniques and tools are we going to use for activating regions of the brain? So the second neuropuncture electrical technique teaches us that we can target specific receptors for specific neuropeptide release. Might be dopamine, serotonin, GABA, benzo, could be melatonin, different chemicals, right? Or target regions of the brain, right? Like the basal ganglia, right? Now, all of that is point specific and dosage specific, okay? So what that means is it's not, okay, we can put these needles anywhere and just use this particular current and this dosage and it's going to activate that. This is specifically point specific and frequency specific that comes from published research, okay? And this has been confirmed with MRI studies or functional MRI studies or PT scans, okay? I'm getting involved in some great brain scan research with a nuclear radiologist, and I'm so excited to see the pre and post test with the neuropuncture treatment. But these are the areas that we know right now that we can activate. We can target the periaqueductal gray for maximum pain management. We can target the pituitary, for neuroendocrine support, hypothalamus for serotonin neuroendocrine support, the HPA axis, HPO axis, visual cortex, right, for visual pathology and visual disturbances. We can target this cortical nucleus tractus solitarius. It's these tracts in the cortical nucleus, kind of the brain stem that is has one of the largest concentrations of GABA and benzos, great for anxiety and sleep. The default mode network in the conference, we have another great speaker that's going to be talking about brain electrophysiology and all about these wonderful states that you can put patients in. The prefrontal cortex, we can target dopamine, emotional stability, and cognitive dysfunction. Somatosensory regions, we're going to go right now. Pain, phantom limb pain, restless leg syndrome, and also things such as CRPS, chronic region pain syndrome, right? And those are things that we don't treat the limb, we have to treat the brain. Now, restless leg is not a somatosensory region. I want to just make that clear. I put that in because sometimes you can also treat that for restless leg, but the restless leg syndrome was a basal ganglia dysfunction, okay? Just to make that clear. The limbic system, we can target different structures of the limbic system to neuromodulate them or even rehabilitate them back into health. Sometimes our patients come in with a emotional complaint. It might be severe anxiety or it might be depression. And that might be because of a chemical abuse or physical trauma that damaged that center of the brain. And what we need to do is send an electrical current there to rehabilitate it. We can do that. Target the hippocampus, Alzheimer's, dementia, amygdala, emotion, fear, anxiety, phobias, language centers, bronchoarenarchies for speech pathologies, for stroke patients. And again, that basal ganglia for movement disorders. And that includes the basal ganglia is actually a collection of structures, which I'll be discussing at the conference. And then that was the second neuropuncture electrical technique. And then we're going to use the fifth neuropuncture electrical technique. And this one's really exciting. I love using this one, and I've been using it for a long time, and research just keeps coming out to confirm that this is very effective. So I'm really happy that has, because I've been using it for so long with great clinical outcomes. So what this one is deep cranial electrical acupuncture stimulation. Deep cranial electrical acupuncture stimulation kind of speaks for itself, but we're going to break it down. And let's talk about that. That's the first aspect. The second aspect is electrical acupuncture magnetic stimulation. So this applies mainly to neuropuncture scalp system, okay? We don't use this really in any type of the body because it's a deep cranial effect. So we only use this particular aspect of that technique in the scalp system. The neuropuncture dosage we use to target the cortical structures and neuro-rehabilitate them back into health, okay? So we can target the structures underneath the skull. And again, when we have really examined the brain and its reference to the skull and where we place needles to really reach those structures of the brain, it just is so much more powerful and effective clinically. And where I got this technique from was by also studying some TMS, transcranial magnetic stimulation. So transcranial magnetic stimulation has some great research behind it. It is very comparative to what we're doing here, what we do is comparative to what TMS does, but obviously on a much lower scale. And we have to keep that point very clear. We have to be honest with that, because if we mention that to, let's say, a medical doctor, they'll be upset with us, and I'll show you why. But TMS has been, what we can do with this, with DCEA and TMS, similar properties, is we've been shown to heal the brain, right? And regenerate local neurons and stem cells locally to heal the brain, okay? It's been shown to increase cerebral blood flow, okay? And increase neuroactivity for areas that might have been diminished in activity because of trauma or because of chemical deficiencies. Now, magnetic stimulation what is that? Because I want everyone to understand that, because I'm not saying that we can do TMS. Okay, that's very clear, because this machine or any of the other electrical acupuncture stimulator units on the market are not going to be as strong as TMS. I just had a meeting with someone today that told me that he calls TMS like a sledgehammer. He said it's like a sledgehammer compared to what we do with electrical acupuncture. It's like a laser surgical tool, what we can do. So, but transmagnetic stimulation is a non-invasive procedure that uses magnetic fields to stimulate the nerves in the brain to improve symptoms of depression. It's been really well documented for depression. And that's right from the Mayo Clinic, okay? Now, that's been used when other treatments are not effective. They have other treatments they also use, but the TMS is a non-invasive technique. What they use is electromagnetic coils placed against the scalp near the forehead by the prefrontal cortex. That's where the dopamine receptors are, the D1. The anterior cingulate cortex is right behind the prefrontal cortex. And they use that. It's painless, okay? It's a magnetic pulse that stimulates the nerve cells in the region of the brain. And it definitely does have an effect on mood and depression. And it's thought that it activates those regions of the brains that have been decreased in activity in depression. So that's TMS. I just want to show a picture of it, okay? And this is kind of how it works. Okay, they put the magnet on, and the magnet causes this electrical current to transcend the cranium, the skull, and stimulate those cortical structures. And that is the machine that they use. So look how big that is, right? We don't want to make a mistake, because I've worked in hospitals, my clinics in hospitals, and whenever I've said that, some doctors are like, really, you could do that in your office? Because they've been trained in TMS, maybe in medical school. And I'm always saying, well, it's not like TMS because it's not as big as, we don't use those electromagnets. We're going to use an electrical stimulator. And when we place the needle into the scalp and we attach an electrode to it, like so, guess what? The electrons, as they touch the needle, they generate an electromagnetic field, okay, at the location of the needle. And what that does is that is going to stimulate those cortical structures underneath the region that you're needling. So again, the deep cranial electrical acupuncture stimulation is applicable and most applicable in the neuropuncture system to the neuropuncture scalp system, not the body, not really the auricular, right? And it is used to target the cortical structures, right? But there's a lot of cortical structures that we can target that's on the surface of the brain. So we do have specific frequencies we like to use. I always start at 2 hertz millicurrent, okay? And if you're familiar with the Pantheon, we'll talk about this in a second. You would put that in the top, the millicurrents. You could just put this first dial on 2, flip it on to continuous, and there you go. And then this is the outlet. So you just turn this up, and you always want it comfortably strong. More is better, but don't create pain. So above the threshold of sensation, below the threshold of pain. You can go to 2 to 15. 2 to 15 is that sweet spot of dosage that I like to use for scalp neuropuncture, okay? I've seen it effective where it's not going to create a headache or a migraine, but for paralysis and stroke, like we're going to talk a little bit about tonight, you can go to 2 to 30 hertz of mixed frequency. And what you would do there is just put the Pantheon mixed and go 2 to 30 or even 2 to 100. And that's strong, but you're throwing a lot of electrons with a high frequency to generate a nice electromagnetic field to target those underneath structures. And what can you target? Any of the lobes. So you can target that primary motor cortex, the primary somatosensory cortex, prefrontal cortex, dorsolateral prefrontal cortex, language centers, Broca's and Wernicke's, cerebellum, the visual cortex, and the auditory cortex. That's a lot of treatments right there that you can, and there's even more than that, but I just wanted to give the Cliff Note version. Okay, so looking at this, we're not going to target deep brain structures with deep cranial electrical acupuncture. I want to make that clear. Okay, and that goes back to the understanding the Trinity. Okay, there's other point prescriptions and dosages and point specifics and dosage specificities that can target the deep brain regions. But for deep cranial electrical acupuncture, what we're talking about right now, attaching the lead to a needle creates that electromagnetic field. And when you stack the needles properly, like I'm going to show you, you can target those regions underneath the scalp. So we have that frontal lobe, parietal lobe, occipital lobe, temporal lobe, and we have right here a nice little collection of a few great regions. This would be the left side of the brain, where we have Broca's, Wernicke's, primary motor cortex, somatosensory cortex, and we have also the auditory cortex here and the visual cortex. Great regions that we can all target. Then we have the electromagnetic stimulation effect, okay? And this is the EAMS. And this is when you place needles close enough together that the field that gets generated between them has therapeutic effects. Now, this obviously is not going to work if you're needling Ren 4 to do 20, right? Obviously that, or stomach 36 to stomach 36, which we call the anterior tibialis neuropuncture point. But no, we're not talking about that. We're talking about smaller areas so that electromagnetic field is strong enough where it has an effect on the tissues between the needles. So we do use those in between certain areas to intensify the electromagnetic field and have a therapeutic effect. And here you can just see some examples of electromagnetic fields. And what you're looking is right in between these is where you would put your pathological tissue. Now, when it comes to electrical dosages, we start at 2 hertz, and then we can go to a mixed frequency, again, using that mixed frequency and go 2 to 15, 2 to 30, 2 to 100, different treatment sessions, working your way up to 2 to 100. Now, we definitely use that on scalp regions to maximize the deep cranial with the deep electrical acupuncture magnetic stimulation effect to just really stimulate those cortical structures. But we can also use those on non-healing fractures. I've used them on necrotic bone diseases successfully, ophthalmology treatments and conditions, and auditory conditions, okay? So understanding this, understanding how to enhance it and magnify it is what we do in neuropuncture. So I want to talk about the Pantheon just quickly. That is the device we use in neuropuncture. I use in neuropuncture. That's why I use that to teach it. I use that because I don't get anything for that. I don't get any commission or anything like that, guys. I think there might be some discounts. But let's just say that I don't get anything for it. I'm just saying because it's a great device. I am involved with John in some research projects. We've been involved in multiple electrical acupuncture research projects. I know John well. He's a great, honest man, and that is a great instrument. They are microprocessor frequency developed. So they're microprocessor calibrated, which means if it's, and we've tested this with oscilloscopes and with different devices. When you put the frequency on 2 spits out of the output. If you put it on 15 spits out. If you put on 30, if you put 2 to 100, 2 and then 100 comes out. On other devices I've seen, they're not as accurate. So I really do like this for that accuracy. There's also a lot of safety mechanisms so you don't hurt your patients, which is another big bonus. And there's also some great tests you can do with the Pantheon to test the battery. You could test your leads in your office, and you can test the outlets. And it's just a great device. And I use a lot of this strategy in my neuropuncture system. So I try to always make it 4 leads. So the 8C you can use to treat patients. And this is just a little breakdown for it. It is FDA registered. And I think that's important too, that there are some EA devices on the market that the companies tell us that they are FDA approved for electrical acupuncture. And I've looked them up on the FDA list and they're not. I looked them up on the FDA website and they're not. It's really sad. I don't know if they're trying to be manipulative or they're basically they're devices that are registered for 10s. Yes, we can't do 10s, not in every state, or I don't know where we can do 10s legally. So if you use a 10 unit on electrical acupuncture and your patient has a negative effect, you know, a good attorney that is cross-examining you or defending the plaintiff will just do a background check on the device that you used. And they're going to see, well, they're not even supposed to be using that device. You might get in trouble. So I just always be cautious with other devices. I know Pantheon's a good one. There are a couple on the market also that are good. Also, square waveform, biphasic, red and black lead don't matter because it's a square waveform that all EA devices should have because that was what the FDA approved in 1970. The pulse width on the Pantheon is perfect to affect neural polarization. Pulse width is great. And there's timers and some great default mechanisms so you don't hurt your patients. Okay, so that's the device, the techniques we use in neuropuncture. Now let's look at how we apply this clinically. So for that primary motor and somatal region or sensory cortex, what I like to do is use several needles, okay? So I don't use one needle. What I'll do is I'll put, maybe 3 needles like that and put them all together in a region like that. So now I'm covering a unit or an area on the brain to maximize that deep cranial electrical acupuncture effect and electromagnetic acupuncture stimulation effect. And that's why we like to use multiple needles. We thread them into the region that you want to stimulate. You connect the lead to it like so, nice and simple. I have some pictures I'll show you. So it would be something like that. You connect all 3 needles, sometimes 4 needles, and then you e-stem it. And the dosage you can use, again, we like 2 to 15. You could go up to 2 to 30, 2 to 100, but be careful. You don't want to hurt your patient. Start with 2 hertz, work your way up to 2 to 15 on the second treatment, okay? Now, by using this, what you can also do is when you're looking at that primary motor and primary somatosensory cortex is I like to do Sushinsam, all of them. And you can e-stem right through where the knee and the foot go down into that sulcus right there, okay? And I think that that's a nice technique. And you e-stem right through it, and then you e-stem the line on the opposite, the affected side, right? Because the nerves cross over. So if someone's paralyzed on the right, left side needs to be treated. Someone's paralyzed on the left, right side needs to be treated. They have phantom limb pain on the right, treat the left side. Phantom limb pain on the left, treat the right side. Phantom limb pain is not a limb condition. It is a brain disorder, right? Just like other conditions we're not going to get to right now. At the conference, we'll talk about other ones. So some of the treatments you can treat with this, stroke, obviously, transient ischemic attacks, TIAs, TBIs, traumatic brain injuries, concussions, chronic regional pain syndrome. That was I was thinking of before, CRPS, right? Because that not necessarily might not be an arm pathology. Now we can combine the two, and that's what we like to do. So when we're looking how to apply the scalp with body points for CRPS or even MS or stroke, you needle the brain that had the side that had the clot or the bleed, right? You needle and thread the needles, e-stem it, and then you needle the big neuropuncture points on the affected limb. Or you can pick some of the large acupuncture points if you're not familiar with the neuropuncture system yet. But the neuropuncture points have the nerves that you're activating underneath those points, right? And they're kind of like little regions. But what they're going to do is they're going to make a big impression on the brain, And by E-stem in the brain and E-stem in the limb, that transmission from the limb is going up into the spine, up, and it's terminating in the brain, the area that's damaged. And then you're E-stemming the brain itself. Okay? So you're getting it from both ends of the condition. So here's a little bit of an old chart that I'm sure everyone's familiar with, right? And what I usually do is find do 20, that's the beginning of the motor line. Sensory is back from Sushin-tong, from the posterior Sushin-tong, and I draw right down to the temporal mandibular joint. But I don't go below into the temporalis muscle because that's the face, lips, and if someone has a facial problem, I'm going to use neuropuncture facial prescriptions. I'm going to directly target the supraorbital nerve, the infraorbital nerve, the trigeminal, the facial, the greater auricular, the hypoglossopharyngeal nerve. We could target that with the neuropuncture system. So I'm not going to use a sensitive area on the brain. And this speech region right here that they're pointing to is actually Broca's center. And it's not a coincidence that that is also near the region of what controls the mouth and lips and tongue. And that's why Broca's has to do with pronunciation. Okay, so there's the motor line, there's the sensory line. Okay, so this is another dissection that I did. And what I want to show you here, this is the skull, this is the scalp, and this is the subaponeurotic tissue. And that is the tissue that we're going to be putting the needles into. And it's always so important to see this so that you know the scalp is not super thin, could be thicker on others, but look at the size of that. You can really see that you can put 2-3 needles literally on top of each other like this and thread them like that through an area, and that is safe because you're going to be threading it through the subaponic neurotic tissue, which is that space right there from the skin to the skull. And that's where you want to put your needles. The angle is on that 35 kind of degree angle going down into that tissue. It's not oblique where it's going to go through the skin. You don't want to go down and hit the bone, okay? We do some bone needling in neuropuncture. We call that osteopuncture, but it's not necessary to do that on the scalp right here. You see these nerves that come out underneath the skull. That's going to transmit those signals down into the cortical structures. Plus, you have the electromagnetic field, right? Now, here is some images of some needling. There's the anterior and posterior Sushin-tong, and there's the sensory cortex. And, this was a demonstration. I sometimes even put more needles in there and parallel them. So you can put 1 line, 2 line, 3 line, and group the needles together and clip them with an EA clip. That is, you can E-stem right along from anterior to posterior Sushin-tong, right? And that's the motor primary motor cortex right there. And then you can do and group the needles together on the motor cortex. So therefore, you're getting a stimulation running right down the center from anterior to posterior Sushin-tong, and you're getting that lateral branch of the primary motor cortex. Okay? So again, needle those. You want to, again, thread the needles in. If you can get them in that much, that is great. That's fine. Okay? And put them close together and just kind of thread them right in. I have some really great images and videos at the conference of doing different regions with a lot of needles in the scalp. And then you can E-stem anterior to posterior right over that area and then go lateral down the affected side. Okay? You want to group that together to get that electrical concentration right in that area, right on the skull. Millicurrent, start with 2 hertz, go to 2 to 215. When you're on 2 to 15 hertz, if you're using the Pantheon, this would be on mixed. Hope that was on battery test, excuse me. See, the green light was on, that shows the battery's good. Now it's on mixed. And let me turn it off first. Okay. So we're going to put it on mixed. And then what we're going to see is 2 to 15. Okay. Now, whatever dial you're using, this is the voltage. What you want to do is increase the intensity only on the higher frequency. The patient doesn't feel it, you stop. Then it goes with the higher, turn it up, then stop. Higher frequency. Oh, there, doc, I feel right there. Perfect. Let it sit. Okay? And if it's too sensitive at too low voltage, then you might want to adjust the needles a little bit. Okay, I really haven't had a problem with that. I'm sure it's experience that always helps out in those situations, but you really don't want your patient ever to be painful or don't want it to be uncomfortable. Just remember to increase it at the higher frequency, okay? If it's 2 to 100, you don't want to increase it and have them feel it at 2 hertz. Okay, feels good right there. Then it's going to switch over to 100 hertz and your patient's going to be like, get that off. So it's going to be too strong, okay? So you always want to increase it if it's 2 to 100 at the 100 hertz and then stop once it goes to the 2 hertz. Just relax, okay? And then go back up again. Okay, perfect, okay? And get that strong sensation right on that area. Now, something that's really important, movement, okay? Movement with your patients, okay? This echoes back to the beginning of acupuncture treatments. This flows, I think, inconsistent with any other scalp system, except I haven't seen any scalp systems that really talk a lot about electrical acupuncture, but movement's important, right? Because you're making that neurological connection. You're stimulating those neurons, so you want to activate that pathway and connect that neuron, right? And help create that neuroplastic change. So you can do passive movements, active movements with them, breathing, visualization. Sometimes what I'll do is you can do EA on the scalp, EA on the body for maybe 15 minutes or 20 minutes. Take the needles off of the body, keep it on the head, increase the intensity on the head, and have them move their arms or legs. If it's pain, have them breathe, open, and close, okay? You could do some mixing some auricular with that as well. I like to mix the auricular system in there to help with pain cases like CRPS, okay? Another nice technique is I've learned this from, I've had some great experiences in my professional career. Like I said, I've worked in several hospitals. I've had clinics on campus, some hospitals, and I had also worked in the big addiction centers and also in an awesome integrated pain center. And I worked in the physical rehab department. I was the guy doing acupuncture. I was doing neuropuncture. And I worked with 2 great docs. One was a doctor, a DPT, so a doctor of physical therapy, very educated, awesome physical therapist, and then an awesome chiro. And that chiropractor I work with, Dr. Danny Sam, man, he is awesome. And he was surgeons that came new into San Diego would want to have lunch with him because he would help them out with things. He was just a great guy and very knowledgeable in medicine, especially in physical rehabilitation medicine. So I give my hat off to him. He's a great guy. And he would do TENS unit on patients, and I would do scalp EA on them. So what you could do is in your office, TENS units we can use. I don't think that is outside our scope. Or if a patient was given a TENS unit from their physiatrist, which is a doctor of physical medicine and rehabilitation, or if a doctor prescribed them a TENS unit, yes, bring that in. I'll show you how to use it. So in neuropuncture, we go over frequencies and what those frequencies do with receptors and things like that. But what you can do is just put them on motor points or large acupuncture points on the affected limb. And while you're e-stemming the head, have them move the limbs with the TENS unit, okay? There's a lot of research now being done with that in rehabilitation medicine, where there's even devices now where they put on the muscles, activating the muscles while the patients are rehabbing. And that stimulation going through the muscles helps break up fibrotic tissue, helps heal the muscles. So doing that and the scalp will help initiate that cortical spinal tract and the spinal thalamic tract and heal it and regenerate it and rehabilitate it. Okay. Hope everyone enjoyed that. We do have some great neuropuncture wall charts that are great for educating your patients and your physicians. I always keep these in my treatment rooms, and if a doctor comes to visit, hey doc, come here, let me show you something. Did you ever know how acupuncture works? This is the neuroscience of acupuncture. Goes through those 5 neurophysiological mechanisms. That's the one on the right. One on the left goes over the neuropuncture auricular system and the neuropuncture scalp system. And you can talk about those brain regions to the doctor and how you can activate them with the neuropuncture system, which we got to improve our language so that we can better communicate what we do. Okay. It all comes back to the Trinity, and that's really important to neuropuncture. And again, maybe remember in the scalp system, we're only using aspects of this, right? The auricular system, we use aspects of this. In the body system, we use aspects depending on the case. There's a clinical process so that we can use the 21st century medical sciences and examinations and images and lab tests that we have today. Very important for us to be able to do that. Include that to any other modality you're used to using, right? That's fantastic. We have to use that holistic approach. And again, what does that give us? That gives us three very powerful things: a neuropuncture prescription, a neuropuncture dosage, neuropuncture treatment plan to best neuromodulate, neuro-regulate, and neuro-rehabilitate your patient's nervous system back into health. And that's what you're doing if you're using electrical acupuncture, whether you know it or not. And that's why it's good to make sure that you're trained well in it. Okay, guys, I hope you really enjoyed that. That was kind of a quick little run through. I'm going to go through a lot more in the conference, different brain regions, different needle techniques, different prescriptions to target different conditions. We have just an amazing lineup. We have 4 awesome speakers. I'm in there, but those 4 are just superstars. We have Dr. Andy Rosenfarb, microacupuncture 48, neuro-ophthalmology. He's going to be going into the neuroanatomy and physiology of the eye, because it's important that we know these sciences and the anatomy so well so we can communicate that. Matt Callison, I don't think I have to say anything else. He's the originator of sports medicine acupuncture. He is just a great colleague and a great friend, an amazing presenter. And he's going to be teaching upper nerve entrapment with cadaver research. It's going to be great. Dr. Dave Miller, medical doctor. He is a board-certified pediatrician. We're not just going to be talking about pediatrics. We're talking also about the research he's done and how he's got an acupuncture and integrated medicine in hospital settings, and he's running a large hospital setting right now in Iowa. And then Dr. Drew Pearson, brain electrophysiology, an incredible man when it comes to understanding peak states, the brain physiology of functionality, but also neurofeedback and electrical acupuncture to also target regions of the brain. So a great lineup. I do want to say one other thing. We pick our speakers based on their expertise and their speaking, okay? Because some people have asked us, commented, why are there all 5 white males? And we did not pick it it wasn't like we did that on purpose. We're not biased for any reason. That's just what we gathered. We asked other people to come when there was conflicts of schedules. Our 2022 calendar is already confirmed. We have different ethnicities. We have female speakers. So I don't want anyone to think that we're trying to just do anything. I know people get sensitive nowadays, and it's not that way. It just happened that way, but they're great speakers, all neuroscience. You guys are going to love it. Enjoy. And there'll be a big special that we're offering, a flash sale that'll end tomorrow night, midnight at Pacific Standard Time. So jump on it. All
right. Well, we do have some questions if you have a couple of minutes to answer some for us.
Absolutely.
One person right now just asked, what was the name of that chiropractor that you were discussing?
Where is that person located?
I am not sure, but they just wanted to know the name of the chiropractor.
He's in San Diego, the chiropractor. It's Dr. Danny Song. He works with Dr. Michael Moon. He was the medical director of the center. That's where the fluoroscopy machine is. That's in my book. I have pictures of us needling for spinal cord injury patients. Great guys, great center. A lot of fun.
All right. And then we have a few other questions here. So someone wanted to know, what does one PUP stand for? It was, ONE/PUP.
PUP is pain upon palpation. So it's a physical exam of palpation that we do in neuropuncture. It scales from 1 to 4. It's assessment for pain.
Next question. Can this scalp system be used with somebody that's currently receiving ECT?
Oh, very nice. So again, let's find out, what does ECT do? What do we do with that? That's electrical shock therapy, right? And I actually have a great case of a NeuroLab member that treated a patient who was, it's in our book. We just published our last book, all case studies with great artwork and point prescriptions. And there's a case in here, medication resistant depression. All lifetime suffered from it. And he was getting, I think he had multiple rounds of electrical shock therapy, that ECT treatment. And We waited till he was done with that, because what that does is what does that do? That is interrupting protein synthesis in the brain. We don't want to do that. We want to heal the brain. So that's a little bit different. So I would just let the patient run that round, let them finish with that, then treat them with some of the neuropuncture treatments that we have specifically for depression. Very effective. That case was just a star case. One of our members in Florida did a great job on that. And yeah, we could combine it, but I'd wait till they're done with that treatment first.
All right. And then next question, wondering, in patients with herpes zoster of the face, where the face is too painful to needle, would you use those temporal homunculus points?
No. There are certain techniques we use in neuropuncture to reduce neural inflammation, and I would use that instead. Yeah, because, when you have something like that on the face that's causing that issue, you need to treat that. And the first part of the neurophysiological neuropuncture mechanism is what? The local effect. There's a lot of technique you can do just by properly sensitively needling around those areas. So depending where it is, if it's in the eye, I would still needle. There's, neuropuncture points we use around the eyes. You can use, bladder 1 threaded, or not bladder 1, bladder 2 threaded to Yu-Yao, stomach 2. And there's points around the eyes I would do if it's around the face. There's points around the face you can use, and I would directly use that. And then there's a certain neuropuncture dosage we use for neuroinflammation. So I still wouldn't use the temporalis muscle. Why? And then there's other body points you can use to really down-regulate the pain in the face.
All right.
Auricular as well. Don't forget. Auricular is really powerful.
Sorry, didn't mean to cut you off.
That's right. No, please.
Next question. How and where can we get access to the point prescription for the diagnosis you referred to earlier? And then do you have anything for tinnitus?
Yes, we have a lot for that. So I have an entire online training platform, okay, where I have over 100 hours of neuropuncture neuroscience content, a video library, podcast, 68 webinars, all breaks down the entire trinity, plus webinars on different aspects of tinnitus, restless leg, neurodegenerative diseases, women's health, pain management, opioid titration, headaches and migraines, neuropathies, and all that is on my online training platform. Anyone that's interested, shoot me an email, neuropuncture@gmail.com. Okay. And I have some specials I'd be happy to share with you guys. I have 2 really nice specials to get you into the platform.
Perfect. All right. I just put the email address into the chat, also a link to his website, and there's a link to the upcoming conference as well. Also, there's links in the email that you're all going to receive 5 minutes after we end. Let's get to the next question. Will neuropuncture help with essential tremor of the head? Okay.
So tremors, okay? So when you go back to the beginning, right? The neuropuncture, what's the clinical process? What's their medical diagnosis? Review the case file. What's the neuropathology? What's the cause of the tremor, right? So there's different movement disorders, right? Parkinson's, restless leg syndrome, central tremors. Where are they coming from? They come from different regions of the brain. Once you identify with that, yes, there are definitely techniques that you can use to target those regions of the brain. And I'll be covering some of that in the conference. Absolutely.
All righty. And the next question, is the Neuropuncture Scalp system being used in lieu of body points to treat all pathologies? And are there any contraindications?
Good question. So sometimes we just use scalp, absolutely, but I like to combine it with auricular and body, or sometimes just a few body points. So like I said, I use the Pantheon, so I always make sure that I'm using, just 4 leads, okay? So sometimes my point prescriptions are 4 points, maybe a bilateral point on the bottom of the legs, and then 2 points on the scalp. And I combine that together because maybe that condition isn't just the prefrontal cortex and hypothalamus, maybe you also need some neuroendocrine support. So to put all that together to heal the patient, you need maybe some extra stuff. So depending on the case, sometimes, yeah, it's just scalp. Sometimes we need to incorporate some body points to help elicit that signature. Contraindications, if there's any metal in the brain or any implants in the brain, like for Parkinson's, if there's a deep brain stimulator, or if they had some type of trauma where there's a metal plate, you always want to be careful. Don't put metal don't put the needle on the metal, and don't run electricity through the metal or through any of those deep brain stimulators. Those are the main ones. If they're prone to migraines, be careful, watch the stimulation. That's always err on the side of caution. But as long as you're careful, and that's why I always urge, try to train with me. These are great webinars, don't get me wrong, but this is, we're neuromodulating, we're regulating, and we're trying to rehabilitate the central nervous system. It's best to get some really good hands-on training if you can.
We get this question in every single webinar that talks about electroacupuncture. We were taught not to cross the midline. Is this accurate?
That is absolutely 100% not accurate. I can't believe they still teach that. If anyone that is still saying that, I'd love to know the evidence of where and why that is not supposed to be done. 100% false. I cross the spine all the time, and there's research that we've done where we put needles into the spinal cord, into the spinal space, and run electricity through it. So if there's a concern that you're going to affect the spinal electricity or the proteins or that's not true. And then we do bilateral points in neuropuncture and run the current up into the body. So no, you can absolutely cross the body. You can cross the head like Shishin-san to Shishin-song on the opposite side if you want. That's fine as well. The two lateral Shishin-san points, and there's just techniques of why you want to do it. That's the most important. Why, right? And then you got to get to know your electrical sciences. These are very safe, guys. All of our electrical devices are very safe. The FDA made that ruling in 1970, biphasic square waveform. The voltage can only be so much. It can't create electrolysis. That's why the polarity switches. They made it very safe. So, I mean, we've had discussions with the FDA and some of our research groups to try to make a monophasic waveform so we can do some research. They won't even let us use it in research. So our devices are really safe. You have to be really reckless, but it's still important to know your device, know your electrical sciences, and know the reason why, right? That's why information is really important. 21st century medical sciences.
All right. And actually, I was seeing if because Tiffany's here, but I was going to see if she can answer this. But somebody wanted to know, do the recordings come with the student rate for the conference?
Good question. Tiffany could probably answer that. Have them ask Tiffany that. I know they're obviously not going to get CEUs, probably not the recordings either. It might just be for the live, but ask Tiffany. Tiffany's our event organizer. She's awesome. Tiffany Hansen, she rocks. She's great.
I just put her email in the chat, so if she's not still here and she can't answer, shoot an email to info@nacseries.com, and then she'll get back to you and answer the question as to whether or not the recordings come with it. All right, and let's move on because we have a few more questions if you're comfortable answering a few more. All righty. Do you have a standard length of needles that you're using for scalp acupuncture?
I like 30 gauge. Oops, that's a bent one. 30 gauge, 25 by 30. I like these. This is the ones that Jeff sends me because you're awesome, Jeff. right here, 25 by 30s. These are great. Here are little longer ones, the 40s. But, are you going to be threading this much into someone's head? Most likely not, so I usually like these, the 30 gauge, and then you can put this much, into their scalp, even if I'm doing yin tong or just do 20, I want to thread, that much in, I want to thread that much in, Can everyone see that? Yeah, right there. I want to thread that much in, and then I just angle it in the direction of gravity, because when you start to look at, and again, this is not to take anything away from Chinese medicine, okay, but the energetic model, I have a lot of this on my platform about the history of TCM, looking at other cultures and empires at the time the Huangdi Neijing was written and predates the Huangdi Neijing. A lot of understanding of medical understanding of physiology, very similar. Socratic medicine, same time as the Huangdi Neijing, very similar ideas of the body and pathways and air going in and traveling. So the energy model really is it's controversial and yet to be confirmed, right? So needle in direction of the channel, defined channel, right? And that's why I call them channels, right? They're pathways or networks, and there's a lot I can talk about that. That could be maybe another one, Jeff. But so if I want gravity to help me, if they're laying face up, I'm going to needle this back and do 20, and I'm going to put a nice amount of that needle in, so that gravity holds it. When I clip a lead to it, I want to clip this as close to the head as possible so nothing hangs on it. And if it does, it's hanging in the direction of gravity, okay? And then if I do same thing for yin tong or stomach 8 or sushin tong or amien or other points on the head that I'm going to be targeting, I want to thread a nice piece of it. And a 30 gauge is perfect. You know, it's not too big, it's not too short. You can put a couple of them together, you know, and then just, you know, clip them like so. Oops. You know, like this. You know, to get them all together, it's maybe a little sloppy. But, you know, something like this, perfect. Boom. You know, like that, great. That's nice. And a 30 gauge or 30 length seems really good.
Perfect. We do have somebody who's attending the conference but may miss some of the classes due to work. Are they going to get access to the recordings?
Absolutely. Anyone that attends a conference, you will have access to recordings. I believe, again, that's probably a question for Tiffany. Okay. But I believe, yeah, you have access to the recordings and obviously CEUs and all that stuff.
Perfect. And then somebody wanted to know, is this a modality that can be used by chiropractors?
Sure. If the chiropractor, I mean, it's a modality if they're trained. I think chiropractors, for the most part, have to be a licensed or have to have acupuncture in their scope of practice, and they have to fulfill those requirements to get the ability to perform that. Just like I can do injections. I live in South Florida now. Awesome. I can't just do I had to take a course to do injections. Chiropractors, I believe in certain states, they can do acupuncture if they complete certain courses. Every state's different with course curriculum, and maybe their scope of practice may change as well. So if you're a chiropractor and you're asking, check your state if you can do scalp EA. And if you can, give me a call because I do train chiros. I train MDs, DOs, NDs, and licensed acupuncturists.
All right, we have I think a couple of minutes for a few more questions if you're okay.
Yeah.
All right. Let's see. I'm going to do 2 more. Sorry. So how does this approach work in conjunction with traditional diagnosis and treatment?
So what you have to think about, and I'm going to be talking this a lot in the conference at the keynote speech, because the way I look at this is the TCM language, right? The traditional language of pattern differential diagnoses, right? What language is that? That's the language of 2,500 years old. I studied in China. I have taught in China. I've worked in their hospitals. I've studied acupuncture-assisted anesthesia there with Dr. Frank from Chicago, who's awesome. And pattern differentiation, what I sometimes associate to is like the Socratic humors. That would be like us going to our doctor and saying, okay, so I have diabetes. Doctor, I want you to put that in the diagnosis of Socratic humors for me. Okay. So we have a diagnosis now, 21st century medicine, depression, liver qi stagnation, kidney yin deficiency, qi deficiency, phlegm accumulation. Those were patterns that they used back then to see the pathology, understand the physiology. Now we know that depression is a result from dopamine, prefrontal cortex, could be from trauma, serotonin, hypothalamic structures, could be coming from the gut, but it still has to do with those chemistries of the brain. So I don't look at pattern differentiation anymore. Even when it comes to herbal medicine, I look at the pharmacology of herbs. I use maybe pattern differentiation to get me into the ballpark of certain herbs, but then I look at the pharmacology of them. And when you look at real scholars in TCM today, Dr. John Chen, there's this other one I talk about, I forget, Noger, I'm drawing a blank right now, but I have a list of them. They all say we should keep our TCM language to ourselves. And a lot of the translations that we use, like Qi, there's the Western understanding of energy has no resemblance to the TCM character of Qi. So that makes we have to think about those terms. So if a patient comes to me with a particular neurological condition, I don't go to a pattern differentiation. I know I know what's wrong. I have the root of the condition. We have molecular sciences now. We know the root of the problem. So let's target that pattern. and let's target that problem. I don't mean to use pattern. I use that in the wrong context. Sorry. Let's target that underlying pathological tissue, because we can confirm that with MRIs, with molecular sciences and neuroscience now, like they did not have 3,000 years ago. And that's just a real hard fact for some of us, I know, to swallow, but it's a fact. So it doesn't translate to pattern differentiation.
All right, let's do one more question and then we'll let you end the night. Let's see. I was just answering, somebody just asked about the student rate. So currently it's on sale for $299. As of midnight tomorrow, it'll go back to the regular price of $450. That's the student rate, no CEUs. And then the full rate for practitioner with CEUs is on sale for $599. I think regularly $750. So definitely sign up before tomorrow night, because otherwise you are not going to get this discount. And then let's see. Do you have, this is the last question. Do you have a prescription for addiction?
I have several. I have some really great ones for addiction. Whoever's asking me, shoot me an email. I teach this online. Again, I don't just like to spit out this prescriptions, because this isn't cookie cutter. We don't want a cookbook like that, right? You want to understand the medicine, right? You want to know when to adjust your treatments based on individual patient needs to give them the best care. I have several really good prescriptions for addiction. Shoot me an email, neuropuncture@gmail.com.
Perfect. Well,
yes,
Michael,
I have a couple really good ones. You'll love it.
Well, Michael, we cannot thank you enough for this webinar. It was so informative. It was so helpful. I know you've had a tough week, so we really want to thank you for your time, the effort that you put into this. Please take a look at this conference. It's going to be amazing, groundbreaking information. There's a link in your email, and they did turn on the early bird special just for you guys tonight, so take advantage. And I hope to see you guys all at our next webinar, which is going to be happening on February the 23rd. It is tips and tricks for knee osteoarthritis. So please join us then. Michael, thank you again, and everybody have a wonderful evening.
Yes, thank you, Jeff. Thank you, Lassa. Appreciate you guys very much. Appreciate it. Thank you.
Thank you. Good night.
Good night.